Such an interesting conversation this afternoon as a first of its kind summit comes to Metro Atlanta. It's really an important issue impacting so many of our veterans, and that's brain health. Alzheimer's Association is partnering with Emory University and community groups to help veterans and their families better understand the heightened risk of dementia and cognitive decline, and then what can be done about it. Joining us now is Gerontologist Mary Caldwell with Skylark Senior Care to talk about the upcoming Veterans Health Summit and why this conversation is so critical right now. Mary, thank you so much for being with us.
Hi there. Thank you for having us. We're really happy to talk about this.
Well, I'm so interested in this topic because there is this increased risk that a lot of families aren't aware of. So let's start there. What should families know coming into this?
Well, I think one of the first important things to understand is that there are things that veterans go through or conditions like traumatic brain injury, PTSD, and environmental factors in deployment that absolutely put them at a much higher risk, really an incredibly higher risk than civilians to develop Alzheimer's or related dementia in their lifetime. And of course, we have agency over some of the risks that we have of developing Alzheimer's. So we thought that it was important that veterans and those who serve veterans and veterans' families know about this risk so they can reduce that risk.
Now, it's such an important point. For families who are watching and might be concerned, what are some of the first signs of cognitive decline?
Well, it is individual, of course. Every individual might experience a different symptom first, but overwhelmingly, memory loss, maybe frustration, lack of organization. What we like to say is any change in thinking or behavior that just raises a red flag. It's very important that we as a community understand there's such a big stigma around Alzheimer's, just even the word Alzheimer's and other dementias. But right now, we live in an age of prevention and treatment. And so, much like other chronic diseases, if you can get that great, clear, early diagnosis and learn of treatments, then you will have a better journey, and often if they're in the case of Alzheimer's and if you're diagnosed early enough, there are new treatments.
Yeah, that's such important information. What's unique about this summit? What are you going to be discussing that's different here in Atlanta?
Right. Well, everything about it is different. It is the first dedicated community conversation on veterans' brain health in our region, or really anywhere that I know of. And this is my life's work, is educating, teaching, researching, and caring for those that are living with dementia. This is a really high collaborative event, and so Skylark Senior Care, the Alzheimer's Association, and Emory Veterans Program are the organizing agencies involved. But we have worked all along the way with many, I mean, over 15 veteran organizations in the region, and they've had a really strong part in how we're doing this, the production. And so this is going to be a great place for families, professionals, social workers or any aging professional that works with veterans and veteran families to gather for not just this incredible education. Our keynote speaker is Dr. Anastasia Nichols of Emory Veterans Program, but also on the ground answers and on the ground resources so you can leave with real valuable resources, like I said.
I love that. So important that people have something to reference when they leave. They know who to call if they need help. You talked earlier about PTSD and traumatic brain injury, so many
Right.
things that our veterans really struggle with. Can you talk to us about how that impacts long term brain health?
Well, sure. any insult to the brain will raise your risk of developing Alzheimer's or dementia. And certainly these events that so many veterans experience in deployment, the PTSD, the TBI, mild or otherwise, and then the environmental factors of deployment really do raise that risk in that the brain can be injured. In PTSD, there begins to be a response that sort of ignites the fight or flight impulse, and all of these things affect our brains. For an example, I'll give you an analogy. Depression is brain degenerative. If you have depression and it's not treated and it becomes clinical and it remains untreated, then that is not good for your brain. So we're just really on the cutting edge of brain health and learning more about it. I really wish we had this kind of thing in all elementary schools because it's something that we do have agency over.
Yeah,
But
wow,
I
what an
hope I've
important
answered
point.
your question. It's quite complicated why TBI and why PTSD, what is going on in the brain, but Dr. Nichols will certainly be addressing that in detail at the summit.
I really appreciate your time. That was so interesting, and I know this is going to mean so much for families. Thank you so much for speaking with us today.
All right, thank you.
All right, have a nice rest of your day.